When you're pregnant, worrying about your baby is stressful enough. When gestational diabetes develops during pregnancy, you start to worry not only about your baby's health, but yours as well. We have Dr. Orlando Cerise here from the Institute for Women's Health to talk about causes of gestational diabetes and what we can do to prevent it and control it. Thank you for joining us.
My pleasure.
So tell us, first of all, what exactly is gestational diabetes?
Gestational diabetes is a condition of glucose intolerance that's discovered while the patient is pregnant.
And what are the signs for gestational diabetes for women?
Well, generally, most patients don't have any symptoms of gestational diabetes. It's important that those patients get tested at the appropriate time in pregnancy, because being pregnant alone is going to increase the chance of developing gestational diabetes. The placenta produces 5 or 6 hormones that counterbalance insulin. So just being pregnant is a risk, and I think it's important that patient be tested at the appropriate time in the pregnancy.
I understand that San Antonio has double the national average for women who are at risk for gestational diabetes. Why is that?
I think it's a twofold reason. I think we have a large Hispanic population, and that's one of the risk factors, as well as African American and Asians, but the Hispanic population, and also we have a population that's heavier set. You know, obesity is a factor for developing gestational diabetes. I think a combination of those two are two of the main factors why I think we see a higher risk in our population.
And why is it so important then to monitor this and prevent it for women who are pregnant?
Well, I think it's important because we know that uncontrolled diabetes in pregnancy increases to a much larger baby at the time of birth. So there's a risk of increased traumatic birth, increased risk of C-sections. Also, the newborn period of the baby after the baby's born increases the risk of hypoglycemia or low sugars, where the babies have difficulty controlling their sugars, etc. So I think it's important both for mom and the baby to have well control.
And so in your practice then, you're obviously every day dealing with pregnant women. What kind of advice do you give them to kind of make sure that they stay away from, gestational diabetes?
Right. I think it's important. Diet plays a huge role. I think decreasing the carbohydrate load, to make sure that they only try to incorporate about 40% of the diet be carbohydrates, so decrease the sugars, the starches, increasing a moderate level of exercise, mainly weight training exercises to increase lean body mass would also help try to metabolize the sugar better while they're pregnant.
And for you, lastly, what kind of a message would you leave for our viewers, for not just those who are pregnant, maybe the dads as well at home, for the helping their wives who are pregnant?
Be supportive, be encouraging, follow the diet, exercise, and follow your doctor's advice.
Perfect. Thank you very much for joining us, Dr. Cerise,
My
and
pleasure.
for all the work that you do in our community.
My pleasure.